arthritis drugs. Arthritis is a disease. It is caused by a painful inflammation of joints. There is pain in joints, that is called arthritis. Inflammation or stiffness of the joint. It is a common form of arthritis. Osteoarthritis. Osteoarthritis, then gout, fibromyalgia, and rheumatoid arthritis. These are the common form of arthritis. This is there is inflammation or stiffness in joints. There is a joint pain. Now, to treat such joint pain, some gold complexes are used. Complexes of gold. Gold first. Iurium. These complexes are used to treat arthritis. Now, the mode of action is that this gold first complexes, it inhibits formation of O2 radical, which is formed by the dissociation of peroxide molecules. Okay. See, this deactivates singlet form of O2. It deactivates formation of singlet form of O2 radical, and in this way it inhibits the arthritis. Now there are some sodium iurothiamalate. Sodium iurothiamalate. This is a complex of gold. It is a complex of gold. Its structure is like this. Yes. This is the maverick acid. CO double bond O, sodium negative, positive. CO2 N. Negative, positive. So this complex is used to treat arthritis. It is used as an anti-arthritic drugs. Another one is sodium iurothioglucose. Its structure is quite complicated. Sodium iurothioglucose, that also used as an anti-arthritis drugs. These most of drugs are water soluble. Most of gold complexes are water soluble, so they cannot be introduced orally because they undergo hydrolysis in the stomach. So they are given intravenously. Gold complexes are given intravenously because when it gives orally, then they undergo hydrolysis in the stomach. So this is the gold complexes which are used to treat arthritis, which are used as anti-arthritic drugs. The side effect of this drug is the rashes on skin, or we call it as skin allergies. This is one side effect of this drug. And there may be some gastrointestinal problems when given orally. So this is regarding anti-arthritic drugs. Only gold complexes are used to treat arthritis, and arthritis is a simple weakness is a joint pain due to inflammation or stiffness of joints. Now another is imaging agents. So these are the imaging agents. When we require some image of some organ or some part of the body, just like MRI, magnetic resonance imaging, MRI. In that MRI, we get the detailed image of particular part of the body, or we may call it as a angiography. In angiography also, some fluorescent dye is introduced in the bloodstream. Angiography is used to find out the blockage in arteries of hearts, or whatever, it may be peripheral, it may be cardiac, okay, coronary. For that, some drug is introduced in the bloodstream, and that drug is circulated through the arteries or blood vessels, and they are fluorescent. Because of that drugs, we get images of those arteries. Angiography मध्ये काय होतं की एक ड्रग्स आपण ब्लड स्ट्रीम मध्ये इंट्रोड्यूस करतो, मग तिथं तिथं तो ब्लड त्या ड्रग ब्लड सोबत जाईल, तिथं तिथं आपल्याला इमेज मिळते. सपोज दिस इज द आर्टरीज, or this is the network of arteries, so many. When we introduce that drug, then suppose here is a blockage, here this artery is blocked, then this drug cannot go to this artery, it goes from this one, this side or this side, and we obtain the image of this one only, and here we have seen the block. Okay. In magnetic resonance imaging also, we have to introduce some drug that causes the, we have studied the NMR spectra in analytic, that is the magnetic resonance spectra. Same manner, that is the magnetic resonance imaging, that is called MRI. Okay. So in that also, some drug is introduced in the body. That drug goes to particular organ, and from that, wherever it goes, we got image of that part of the body or that organ. जिथं जिथं तो ड्रग जाईल तिथलं आपल्याला इमेज मिळेल, जिथं तो जाणार नाही तिथली इमेज आपल्याला मिळणार नाही. For such cases, we use some drugs. Those drugs are called as imaging agents. Those drugs are called as imaging agents because these are used to obtain the image of particular part, not for the treatment of any disease. These drugs are not used for the treatment of any diseases. These are used for diagnostic purpose only. हे ड्रग्स कुठल्याही ट्रीटमेंट साठी वापरत नाहीत. कशासाठी वापरतात? फक्त इमेज मिळवण्यासाठी कुठल्या पर्टिक्युलर बॉडी पार्टची. That's why these are called as imaging agents. Now mostly these imaging agents are the inorganic complexes. These are the complexes of gadolinium. Gadolinium complexes. Gadolinium is a member of F block elements. It is lanthanide series. They are gadolinium third complexes are used for this clinical purpose. Gadolinium complexes reject some tissues. Gadolinium complexes particular tissues kade jatil, particular tissues kade nahi jat. It has the selectivity. It has the selectivity, and they forms chelate compounds. They forms chelate compounds. Okay. So those gadolinium complexes are used as a imaging agents. Some more complexes of technetium also. Technetium is a radioactive element. Technetium is a radioactive element. It is synthesized artificially. So this technetium element, complexes of technetium can also used as a imaging agent. When we introduce the body, wherever it goes, the radiations, nuclear radiations were emitted from that part of the body, and we detect those radiations, and from that we get the image. Okay. So the technetium complexes are also used as a imaging agents. So this is regarding the elements in medicine. Mostly this topic is new, and very few material